Hi everyone. This video is going to provide a brief introduction and overview of the importance of ethics in the field of applied behavior analysis. So to begin, historically, there are several reasons why ABA was considered unethical. First, there's the belief that ABA can be used to manipulate thoughts and behaviors. However, we know that ABA is therapy focused and really works to teach socially valid skills and or minimize harmful or potentially dangerous behavior. The use of aversive procedures is another potential area of ethical concerns. For example, the use of punishment procedures can be considered unethical, and it is clearly important for BCBAs to be aware of the ethical codes associated with all punishment based procedures and how to mediate risks. These are specifically outlined in the BACB Code of Ethics, which specifies using reinforcement-based strategies and requiring an increased level of supervision and training when conducting punishment procedures. It is also important to remember that historically, the use of ABA procedures occurred in institutions or state-run facilities, and since this time, there's been a lot of societal progress to better support basic human rights for people with disabilities that may have resulted in unethical behaviors in these settings include a lack of knowledge about how to most effectively recommend reinforcement procedures, a lack of knowledge about how to teach these procedures, and this could have resulted and did result in a lack of staff training and or procedural drift from the intended implementation procedures. Additionally, since ABA's initial inception, there has been a lot of progress in the field to help professionals really have a better understanding of how to provide reinforcement through we now have knowledge about how to best conduct things such as preference assessments to identify reinforcement and the role of motivation in regards to helping to shape behavior. And so when thinking about ethics, it's important to note that there isn't, a widely held, refined operational definition of what ethical behavior is. And frequently, there's really a lot of gray area that's involved with ethics. And so this is an area that continues to evolve within the field of ABA. So initially, the board put forth the guidelines for responsible conduct to provide recommendations on ethical behavior. Then in 2016, the board replaced the guidelines with the Professional and Ethical Compliance Code, which is what we are currently held to. Additionally, an ethics course is now required as part of the approved coursework, and ethics is also really emphasized on the BCBA exam. Overall, what it means to be an ethical BCBA continues to be refined as the field grows and professionals come into contact with new environmental stimuli that is going to potentially influence their choices in regards to their ethical or their unethical behavior. So I found this quote from Newman, Reineck, and Kurtz from 1996, and they say that ethical behavior, like any other professional skill, is a discriminated operant that is learned and maintained through contingencies of reinforcement. And so it's important to know that can be a learned behavior, and so we need to consider the antecedents and consequences that shape and maintain ethical behavior, and really consider some of those contingencies that we can put in place to help maintain ethical behavior. And so some ways to initially learn about how to engage in ethical behavior include learning and starting to think about the codes and how you can apply those to different scenarios, being exposed to different types of ethical scenarios and thinking about, how well you can articulate the facts that are involved within that ethical scenario and consider why certain circumstances within a scenario are raising ethical concerns. What is specifically going on that is an ethical issue? And then thinking about and having the ability to identify, okay, given this circumstance and what's going on here, what is going to happen if the code is not followed? And then thinking about how you can identify the best or the most ethical option to respond to the ethical concerns within a given situation. And so as behavior analysts, we really want to focus on how we can utilize preventative strategies to help reduce or eliminate problem behavior. And so in this case, we can think of this in terms of a problem behavior being the same as unethical behavior. And so it's important to ensure we are teaching all professionals these strategies, even if they are not pursuing the BCBA credential, because we know that if they're not exposed to the codes and not thinking about ethical concerns, they're going to be at risk for potentially engaging in unethical behavior. And so there's, just like when we're working with our clients and thinking of ways to teach them new skills, there are certainly ways that we can help develop the repertoire of ethical behavior. And so this can include teaching, modeling, and providing feedback on ethical behavior, ensuring professionals are coming into contact with ethical language and practices, and how to correctly and ethically communicate what the code is saying, and then reviewing how the code should influence your decision-making process. And so if you're out there and you're working in the field, you might also want to consider if your organization is helping you to develop your ethical behavior, because organizations can help shape ethical behavior. And so it's important to consider the different specifics of your ethical behavior, because these might vary a little bit depending on the specific setting that you're working in. So for example, people who work in family homes could have potentially greater risk for dual relationships, or people who work with adults may face different ethical situations involving human rights, including things such as sexual activity or dignity of risk. And so there are additional considerations when thinking about ethical behavior that can be impacted through your organization. And this includes, if you have an appropriate caseload, do you have the competencies to work with the people on your caseload? Is your caseload an appropriate size for you to actually provide the hours that are warranted for all of your clients, thinking about strategies to help ensure that you're protecting your clients. And so one way you might do this is through a declaration of services, which outlines specific expectations of services. And it also can serve as an opportunity to introduce your clients to the code and what it says in regards to what your ethical behavior is. Additional safeguards that can be used to help promote ethical behavior that are frequently put in place include, the board providing us with the code and how we should be using that to drive our ethical and professional behavior. Additionally, different organizations, I know when I worked in adult services, the company I worked for had a human rights committee, which reviewed all of my behavioral plans, especially if there were any sort of restrictive or punishment-based procedures that were in place. So that's another procedure to help ensure that we're engaging in ethical behavior. In regards to research, there's institutional review boards that are provided at universities to review the ethics involved in regards to any type of research. Your organization might have specific policies in regards to how they are interpreting the codes and applying those within the settings that you're working in or providing services in. There's also federal and state legislation and laws, again, to help provide support the human rights of people with disabilities, such as the Americans with Disabilities Act or the Individuals with Disability Education Act for school settings. And so then also, you also have your own individual rule governed behavior to ensure that and that can help you determine, what types of behaviors you should be engaging in. If your organization has a rule, or the code has a specific code that they recommend, then if you are abiding by your rule governed behavior, then you would be following that code or that rule, and then engaging in ethical behavior. And so, I just wanted to mention at the end here that it's really important to consider and identify potential aversive consequences of engaging in unethical behavior. Some of these things could include potentially lawsuits, maybe being reported to the board and losing your credential. There's potential for a loss of services and money, and also potential to perpetuate the negative perceptions of this field. And so we don't, as ethical AB or BCBAs, we definitely don't want to be doing that. And so I just wanted to end here by saying that, you're going to be continued to be exposed to this topic throughout your other BCBA courses. Thank you very much for taking the time to listen. And as future BCBAs, I encourage you to continue to consider how you can work to maintain your own best ethical behavior. Thank you, and enjoy your course.